confusion concerning the voting language. Now the panel's recommending parents decide whether newborns need the vaccine based on the mother's testing status. ABC News medical contributor Dr. Lo Patel's here for more on that. Hi, Dr. Patel. So the American Medical Association and American Academy of Pediatrics just released statements calling this vote reckless and dangerous. They say the vaccine's critical to protecting all newborns. What's your reaction to the vote, and what do you make of the response here?
You know, when I see these responses from my colleagues from these national medical associations, I understand the frustration and the emotion, because this move happened without any change in the science of the hepatitis B vaccine and no new evidence or concerning evidence about the safety or the efficacy. It really came down to kind of an interesting nuance about the timing. And it's sad that there are people on this committee who didn't bring up any of the real world benefits and the great track record of the hepatitis B vaccine in this recommendation that has been proven for decades. And the fact that we've dropped hepatitis B cases by over 95% since the recommendation came into place. What this is doing, Diane, is adding more confusion. And by giving parents this option to have a conversation whether or not there's a universal recommendation, we may inadvertently lead to bigger gaps in coverage and ultimately more babies who get infected with hepatitis B. What's truly concerning are the vulnerable populations in this country who are kind of left in this gap, the people who don't have access to pre and postnatal care or proper follow-up.
Now, Now, the new recommendations aren't saying don't vaccinate your baby, right? They say if a mother tests positive for Hep B, that you should still have the baby vaccinated. And if mom tests negative, then have a conversation with your doctor to figure out what's best. What's wrong with that?
What's wrong with that is the confusion in the wording. And what this will lead to is some people wondering whether or not it's actually recommended at all, or if the changes happen because of some new data. And we've already seen on social media people wondering why this vote even came to fruition. And people are now going backwards and saying, well, hey, was there something else about the hepatitis B vaccine that we didn't know about? And there really isn't. The science is still clear that it's safe and effective. But we've seen in the past, when we remove recommendations and we add on this kind of air of confusion in headlines, we see gaps in coverage. There's a reason that we're seeing outbreaks right now in the country with measles and pertussis and a rise in vaccine hesitancy. And this, unfortunately, is adding to all of that.
What are the harms or risks of vaccinating a newborn against Hep B?
You know, there's no vaccine that's perfect. There are some side effects. Regarding the hepatitis B vaccine, the side effects are mild, such as swelling at the site, irritability, maybe some fussiness. But I will tell you, personally speaking, from my experience, I've never seen a serious reaction to the hepatitis B vaccine. Historically, these are extremely rare, to the point where it's almost hard to actually say it's resulted from the hepatitis B vaccine. But regardless of all of that, the CDC, the FDA, national organizations do closely monitor vaccines over time to look for any safety signals. That is why the VAERS system exists. So when we hear from committees such as ACIP saying they're not paying any attention to the safety of the vaccine, that's simply not true. This is paid such close attention to. Vaccines are among the most studied of all drugs or medical interventions in existence worldwide.
The panel also just voted that parents of older children should talk to their doctor about hepatitis B antibody testing before considering the vaccine. Are there any benefits to doing that?
You know, regardless of whether or not there are benefits, there's a lot of confusion here because this is not standard of care at all, Diane. We're actually looking around right now to look to see if there are other countries who even do this. Having a test to say whether or not you have the antibodies to protect against hepatitis B, scientifically speaking, would work, but this committee didn't mention anything about logistics to show that there's data supporting this decision or what it might be like in terms of going to a clinic, getting another blood draw for your baby, and the cost and the time, what this might look like in resource-poor settings where someone may not be able to go into a lab. None of these questions were addressed. But by putting the option in the air, we can clearly see how this might add some more confusion, as opposed to parents realizing like, hey, this is based on 3 decades of science. This is the way it should be, but ask questions anyway. Now parents are faced with a decision about whether or not they're making the right choice to protect their baby, which is not where we want to be.
The AMA is now urging the CDC to reject this recommendation and, quote, uphold its commitment to science and public health. So what happens if the CDC rejects this recommendation, and what happens if they follow it?
If the CDC follows this recommendation, I believe the projections are that CDC director will sign off on it. This then would become a universal recommendation. What's important is that we do have reason to believe that vaccines for children and insurance will still cover the hepatitis B vaccine. And I want to remind all parents that regardless of hepatitis B status during pregnancy, it is still your option to get this shot and highly recommended. Even if you test negative for having hepatitis B, to still get this shot. People will still have access to it across the board. I think what we were really paying attention to is to make sure that this was still going to be covered and that there was going to be some clear-cut guidance across the country, which we're not really sure that's going to happen.
All right, ABC News medical contributor Dr. Alok Patel, thank you.
Thank you.
And the Pentagon's releasing video of a new deadly strike on an alleged drug boat. Yesterday, lawmakers questioned the commander at the center of another deadly strike. Some are calling a potential war crime. Now Congress is divided after seeing video of the strikes. Our chief global affairs anchor, Martha Raddatz, has the latest. Hi, Martha.
Diane, the lawmakers were wildly